Let's talk about likelihood ratio. So let's suppose your pretest probability based upon the clinical signs symptoms of deep vein thrombosis is 20%. Let's suppose you assessed the signs and symptoms of the patients and your pretest probability of the disease or DVT is 20%, and you did some tests. One test, let's suppose you did test X, and that has likelihood ratio of 1. So what is the post-test probability of DVT in your case? It is still 20%, because if the likelihood ratio is 1, it does not change the post-test probability, right? But the test that you did for deep vein thrombosis, let's suppose that has likelihood ratio of 2. So if likelihood ratio is 2, it increases this pretest probability by 15%. So total post-test probability will be 35%, right? If likelihood ratio of your test is 5, then it increases the post-test probability by 30%, right? So your total post-test probability will be 30 plus 20. It will become 50%. Let's suppose your likelihood ratio is 10 of the test that you did. So it increases the post-test probability by 45%. So your total post-test probability will be 45 plus 20 is equal to 65%. Right? You have to add this with this, right? So conversely, let's suppose any test that you did had likelihood ratio of 0.5. So that decreases the post-test probability by 15%. So if it was initially 20, so you have to subtract 15 from 20. So post-test probability become 5%. If the likelihood ratio of any test is 0.2, then your post-test probability gets decreased by 30%. Similarly, your likelihood ratio is 0.1, the post-test probability decreases by 45%. So you can see, as the likelihood ratio decreases from 1 towards 0, the post-test probability also decreases by this much, right? It is minus, right? It is minus 30%, minus 15%. But as your likelihood ratio moves upwards from 1 to 10, you can see this post-test probability is increasing. So for any test, we check what is the likelihood ratio, whether positive likelihood ratio and negative likelihood ratio, and from that we can estimate the post-test probability of the disease or the outcome.